Hello, welcome to our frequently asked questions. Today I'm answering a question that is commonly asked: do I need to have general anesthetic to have upper eyelid surgery or upper blepharoplasty? Well, in answering this question, I'm going to approach the question in three ways. Firstly, what are the different types of anesthetic that are available? What are the advantages and the disadvantages of those types of anesthetic? And finally, what is the most appropriate type of anesthetic for you? And my name is Dr. Julian De Silva. I'm a London-based facial, cosmetic and plastic surgeon. And the anesthetic that I'm talking to you today are all types of anesthetic that I've used regularly on my patients. And the information I'm giving you is information that I discuss with my patients on a regular basis. So first of all, what are the different types of anesthetic that are available? Well, local anesthetic is defined by giving anesthetic just to the localized area in which you're treating. So really it's using a numbing agent, which is local anesthetic, just in the local area of the upper eyelid in order to numb that area. And the equivalent in, say, dentistry would be just using local anesthetic around the teeth in order to numb the teeth. So the advantages of local anesthetic we'll come on to shortly. What is general anesthetic? Well, general anesthetic by definition means you are unconscious during the surgery. So this means that there are sophisticated machines that are looking after your breathing, and there is an anaesthetist that is looking after your care. And during general anesthetic, there is a tube that goes down your throat and airway, and this ensures those machines and your breathing is well controlled. And this is does require more recovery than other types of anesthetic, and we'll go on to talk about that in terms of your experience in a moment. The other form, or third form of anesthetic, is sedation anesthesia, and sometimes this is called twilight anesthesia. And this type of anesthetic essentially means you are sleeping during your surgery. And by this it means that you are breathing yourself, there are no machines regulating your breathing, and you are just sleeping, just like you would sleep at night, but it's just enhanced by medications. And during this type of anesthetic, all your natural protective reflexes are working normally, and so generally the recovery is faster, and we'll talk about how that works in a moment. So let's move on to what are the advantages and disadvantages of the different type of anesthetic. So firstly, when we're looking at local anesthetic, well, by definition, local anesthetic means you are awake, and the numbing agent is applied just to that local area of the upper eyelid. And this is the advantages of this technique is that, well, with local anesthetic, your recovery is very fast, and you absolutely would go home the same day, and you'd go home very soon after the surgery is finished. The disadvantages are, particularly if you are quite an anxious person, well, you're fully awake or fully conscious during the surgery, and so this may not be the ideal type of anesthetic if you're a particularly anxious or nervous person. In addition to that, if there are other factors such as having undergone previous surgery, any scarring that may potentially affect the effectiveness of the local anesthetic, well, then it may not be the ideal form of anesthetic for you. Let's moving on to general anesthetic. Well, general anesthetic, as we defined, means you are unconscious during the eyelid procedure. And so there are machines looking after your breathing, there is an anaesthetist looking after the care of the machines and you, and this tends to result in a longer recovery. And on average, recovery after general anesthetic may be 4 to 6 hours. And quite a large proportion of patients, approximately 30%, will have some feelings of nausea or sickness after general anesthetic, and this is really a side effect of the general anesthetic. Now, most patients will have some degree of a sore throat because during general anesthetic there is a tube that goes down your airway. Having said this, general anesthetic is a very safe form of anesthetic and has been used for many, many years, and does result in complete unconsciousness during the surgery, and so you will feel nothing and your surgery will proceed without any further issues. There is, of course, a third type of anesthetic, which is called sedation, also known as twilight anesthesia. And this is still not so commonly used like in the UK, but worldwide it is a more common form of anesthetic because it has some of the advantages of general anesthetic and local anesthetic with a faster recovery. So with sedation, you're literally sleeping during the surgery, and so you're still breathing yourself, all your natural reflexes are working normally, but you're sleeping. And so this means that when the sedation is switched off, your recovery tends to be very fast. And generally, most patients after sedation anesthesia can go home after literally half an hour. This is unlike general anesthetic, where the recovery may be as long as 4 to 6 hours. And whereas with general anesthetic, if your recovery is 4 to 6 hours, you may have to stay overnight in hospital. With sedation anesthesia, there is really no chance of that. You will definitely go home on the same day. The other advantages of sedation anesthesia is because being a mild form of anesthesia, the number of side effects is relatively small, and the proportion of patients who may feel nausea or sickness is generally less than 1%. So it has a much faster recovery and less side effects compared to general anesthetic. So moving on, what is the best form of anesthetic for you? Well, undergoing upper blepharoplasty is a big decision for most patients, and you want to have the best possible experience in care during that. And really, any anesthetic should be tailored towards you as an individual to give you the fastest possible recovery and what suits your needs best. So the best form of anesthetic will differ somewhat depending on your personal circumstances. It will differ on the nature of your surgery and the complexity of your surgery, and if you need revision surgery and so on. Generally speaking, with my patients, my preference for upper blepharoplasty is generally sedation anesthesia. I find that this gives patients a very pleasant experience because the sedation means that you are fully relaxed and calm during the surgery, but it also means that you have the best of both worlds and that you have a fast recovery. You will definitely go home after the surgery and generally within half an hour. So in summary, we've talked about the different types of anesthetic, we've talked about the different advantages and disadvantages of different anesthetic, and we've also talked about what may be the most ideal anesthetic for you. I hope this information has been useful for you. Thank you for watching. If you would like further information about having blepharoplasty or eyelid surgery, please have a look at Dr. De Silva's book. This is a comprehensive patient guide with over 250 pages, including color illustrations and photographs, including all commonly asked questions and fears that patients have. This is available through either Dr. Julian De Silva's website or by searching on Amazon.